Good morning, viewers. It is Saturday, November 21st, 2020. This is the breaking news. With a good news from COVID-19. More positive news for a coronavirus vaccine. This time, one has been shown to be 94.5% effective at preventing COVID-19 and doesn't need to be stored at such low temperatures. The trial is ongoing, and the U.S. Moderna plans to apply to regulators in the coming weeks to get approval for emergency to use for the jab. The results come after similar results from the Pfizer and add to growing confidence that the vaccine can help end this pandemic. Look, because interim results for this phase trial show that the vaccine is 94.5% effective at stopping symptomatic infections. It can be transported at a standard freezer temperatures of around -20 degrees Celsius, which could be a significant benefit over Pfizer's vaccine, which needs to be stored at -70. The vaccine requires 2 doses 4 weeks apart. United States has pre-ordered stock at this vaccine, and Moderna expects to have 20 million doses available for the US by the end of this year. And it plans to make 50 million to 1 billion doses available for use around the world in 2021. While the company's president, Dr. Stephen Hodge, spoke to our medical editor, Fergus Walls.
Obviously, we're thrilled. It's been a long year for many of us, and at our company, it's been a long, hard slog to get to the point where we now have clear evidence of efficacy of the vaccine to prevent COVID-19 disease. There was a moment of pretty intense relief. It's been a long, hard strive, as I said, but that quickly passed. After about a minute, it became a realization that now that we know the vaccine works, we have to get busy to work manufacturing it and distributing it. But clearly an important milestone and a great milestone for us as a company and hopefully for us more generally as we fight this pandemic.
Well, let's talk now with Dr. Maria, who is an infectious disease expert for Institute for Clinical Evaluation Science in Toronto, and join me live here on the program. How excited are you by this development?
Extraordinarily so. This is really great news.
Just in terms of what we have discovered a week after the Pfizer results, we were revealed. Is that a coincidence, or is there some data sharing? How is that are getting the results in quick successions?
It's possible that the sort of timeline at which we're getting these results is purely coincidental. I think we're getting them as soon as they can come out. And it happened that Pfizer and Moderna both were able to sort of report those results on similar timelines. But great news for us, a great couple of weeks, I think.
And which bit makes you most optimistic? Is that a statistic of 94.5% effectiveness? Is that the fact that storage temperature is only -20? What is the most excites you?
The thing that most excites me is a combination of the 94.5% effectiveness estimate and the fact that they were able to observe so many COVID-19 cases. Normally when we do a trial, we want to see a certain number of people having the outcome that we're trying to prevent, just so that we know that the treatment is truly effective and not just due to random chance. So the number of cases that we're seeing in the Moderna trial that are being reported in these interim results are promising that this 94.5% effectiveness estimate is really very much a true representation of what we can expect to see in a broader group of people. So I find that very heartening and very reassuring.
Both last week and this week, we are still waiting for safety analysis. What do you think is the likely time frame on that?
I hope it's quite soon. I know that a lot of people, myself included, are really very, very interested in the safety results. I think the preliminary results from Moderna are very promising. It's a similar safety profile to other vaccines that we might be familiar with, like flu vaccines. So you might experience some pain at the injection site. You might feel junky for maybe a day, but not something quite so severe as like a prolonged fever or anything like that. So also very, very good news.
Increasingly, is the focus now, do you think, turning to manufacturing, to distribution, to fairness, all these sorts of absolutely fundamental questions?
Yes, absolutely. What I like to say, and I hope this will be relevant for your viewers as well, as an American, I like to say this is just one inning in the baseball game. So, we needed a vaccine, and once we have a vaccine, we're going to need to be able to deliver that vaccine. So every vaccine that remains in the vial and not in people's arms is 0% effective. So now, absolutely, you're right. We need to focus on exactly how we're going to manufacture all the other components that come with vaccines, the needles, the syringes, the boxes that they're packaged in, and then they need to be delivered fairly and equitably as well as quickly.
Well, Doctor, thank you so much for joining us. Just a quick postscript to what we were talking about this interesting, because the company has been obviously giving that to information about distribution and temperatures. And just a line from the head of vaccine for the US Operation Warp Speed program saying that Modern's vaccine will be easy to distribute, particularly to rural areas, because it can be stored for 1 month at standard refrigerator temperature. So the two at the head of the vaccine at the US Operation Warp Speed program, encouraged by what they have heard from the company there in America. That is the breaking news for Saturday. Thanks for watching. I'm Nur Laila. Have a great day.